Talking today with Dr. Rachel Hunter. She's here from USA Health, and we're talking about benign breast problems women should be looking out for. We're not talking about cancer here.
Right.
All right. Benign breast, but what does benign mean?
Benign means simply, the antithesis of it's not malignant. So benign, don't have to worry about it, but sometimes it does require an intervention.
All right, there you go. This is something that is there that you need to take care of,
yes,
or you may need to take care of.
That's right.
What are some of those types of problems?
So some of the most common benign breast disease that I treat are fibroadenomas, breast cysts, breast abscesses. Particularly talking about fibroadenomas, they're the most common benign breast mass that women have. Up to 10% of women actually have them. And typically occurs in the 20 to 30-year-old female. And we see them when we do a clinical breast exam. We can palpate them and oftentimes and feel them that way. They feel like a little firm, mobile mass. They're usually well circumscribed, meaning they don't have any angulated or sharp irregular borders. And then on imaging, we can see them usually with an ultrasound. We don't always have to do a mammogram to see them.
Is it necessarily always something that you have to treat, or can you just let it run its course in some cases?
That's a good question. No, you don't always have to treat them. So if a patient is completely asymptomatic, they just found it on exam, but it's not bothering them, then oftentimes we'll just kind of watch it with imaging, serial imaging studies. But if they're symptomatic, it's causing pain, increasing in size, those are things where we would want to look at intervening and excising them.
Okay, and there you go. You get to the point where I'm like, look, I'm tired of this. I want to get something done about it. Is that an elective thing for women? If you recommend, let's just watch it, and they go, no, let's take care of it, what do you do?
Right, so if they want to do something about it, absolutely. We can take them to the operating room. We make a little incision over the fibroadenoma, or try to make a hidden incision, remove it, close them up. It's an outpatient procedure. They go home the same day. Recovery is pretty quick. They're back to doing their normal everyday things in 1 to 2 weeks.
All right, I tell you what, you're going to get an opportunity to ask your questions about this topic. That's coming up on the WKRG Facebook page at 12:30, immediately following our broadcast here on News 5 at noon with Dr. Rachel Hunter from USA Health. And we're coming right back.